Assalamualaikum. So I'm Dr. Sindhu, and today I'm going to make video on phases of consultation. Fraser has very aptly described three phases of consultation. That is the beginning phase, the middle phase, the ending phase. Okay, these three phases of consultation need different sets of communication skills. Learning these three phases of consultation help in keeping the sequence and flow of the consultation. And this sequence of three phases of consultation also helps in group practice for MRCGP international OSCE. Okay, so let's start the beginning phase of a consultation. So in this, we have to build a rapport. Okay, building a rapport. A friendly rapport should always be built with the patient. The easiest way of doing that is by giving a respectful smile when you have the first interaction with him or her. That is usually as you greet the patient with hello, good morning, or assalamualaikum. Okay, and if the name of patient is given in the instructions or scenario posted outside the OSCE station, it is important that you make the initial greeting personalized by taking his or her name or surname as appropriate. For example, Assalamualaikum Mr. Salim, or Good morning Mr. Qureshi. And this should be followed by telling your own name very simply. For example, my name is Dr. Sindhu, and there is no need for unnecessary statements like I am your doctor today or I am one of the doctors in the surgery. Okay, these statements are relevant in a UK context. Okay, while this exam is MRCGP International South Asia. Okay, and besides that, try to keep your voice loud and clear so that both the examiner and patient understand what you are saying. Okay, and the other is opening a consultation. Okay, after building a rapport with a patient, ask him or her to tell his or her story by asking an open-ended question or giving an open-ended invitation. For example, Mr. Salim, how can I help you today? Mr. Salim, what can I do for you? Please tell me all about your problem. Mr. Salim, what brings you here today? Okay, so it's like that. Okay, opening a consultation. Okay, now let's talk about the golden 1 minute facilitation. Okay, so in golden 1 minute facilitation, once you ask the patient to tell his or her story, okay, give him or her about 1 minute to tell it in his her own words. Okay, in his own style and in his own sequence. Okay, this golden 1 minute has two benefits. Okay, firstly, it gives you a clue to the focus of the case, and secondly, tells you what is affecting the patient the most. Okay, and further questions can then be based on these clues accordingly. Okay, so the golden 1 minute step is also known as facilitation. Okay, and do not be apprehensive about the patient taking longer than 1 minute for the initial question. Okay, this never happens, and the patient usually stops even before a minute ends. Okay, so do not ask questions in this golden minute. Let the patient talk. Once he finishes, just simply ask anything else to make sure that nothing has been missed. Or you can say if there is anything else, if there anything else you want to add, it's like that. Okay, so he will reveal all. Okay, and then let's talk about the listening skills. So listening is an essential skill of consultation. It is different from hearing. Okay, listening is done with both eyes and ears together. Maintain eye contact while listening to the patient. This helps you to listen to the nonverbal cues. For example, a patient with a drawn face may have depression. A fidgety patient may have anxiety, moaning, clenching his or her teeth may indicate severity of pain. Okay, so with your eyes, you will listen to his body posture, facial expression, appearance, and emotions. Okay, and do not judge or jump to conclusion while listening. Do not listen to respond. Listen to understand what the patient is trying to convey. Okay, so be active listener. Listening is done with both eyes and ears together. Okay, and after listening skills, let's talk about eye contact. Okay, a doctor must make eye contact with his or her patient. Okay, as it helps to focus on the conversation, read facial expressions and other nonverbal clues. The patient feels empathized and trusted and emotionally connected to the doctor, leading to greater satisfaction at the patient's end and better understanding of the disease at the doctor's end. Okay, a doctor needs to ensure that while trying to maintain eye contact, he doesn't end up staring at the patient. Okay, a stare can be very intimidating. Okay, so during eye contact, it is advisable that a doctor should keep moving his gaze from one eye of the patient to the other, then the forehead and chin, and back to the first eye. Okay, so it's like that. So now let's talk about the verbal and non-verbal clues. So verbal clues are the spoken words used to express ideas, thoughts, or emotions. How a patient describes his symptoms and what words he uses to describe them. Give clues to the doctor about the nature of illness, whether it is mild, moderate, or severe. Okay, so it's all about verbal clues, and non-verbal clues are where communication does not use spoken words. Instead, eye contact, hand gestures, facial expressions say it all. For example, a patient wearing ashby, untidy, dirty dress, having a pack of cigarette in his or her pocket, emitting smell of alcohol, weeping or crying frequently, tears in his or her eyes. Okay, so if a doctor breaks a bad news to a patient, the patient may start crying or may go silent. So these are some examples of nonverbal cues that a doctor needs to be wary of and deal accordingly. So to show empathy to a shocked or traumatized patient, you may need to pat his back. Okay, if you are male doctor and patient is a male. Okay, and but you need to be careful with the opposite gender. Okay, it would be better to offer empathy from a distance. In such cases, you can offer a tissue to the crying patient or a glass of water if the patient goes silent. Okay. So, patients' nonverbal communication can be seen or felt by the following gestures like restless posture, movements of mouth, shyness, embarrassment, eyebrows, skin color, head position, tremor, sitting rigidly on a chair, tapping of feet or fingers, head shaking, eye contact. Okay, and a doctor's nonverbal communication can affect a patient's compliance. A doctor can show his or her nonverbal communication in the following way, like posture, facial expressions with his position of arm, position of legs, touch, hand and arm gestures, interest in the patients. Okay, so I should be um, it's all about nonverbal. Okay, so I should have a good grip on these things. Okay, so I'll make another video on middle phase of consultation. Assalamualaikum.